Welcome to The Beat, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Dr. Nasim Afsar, Oracle Health Chief Health Officer. Nasim, welcome. Thank you for joining us.
Thank you for having me, Chitra.
Oracle Health came to the forefront with Oracle buying Cerner a couple years ago for about $30 billion. What is Oracle Health today, and what are the areas of focus?
Yeah, Chitra, the Oracle Health enterprise really focuses on how do we deliver clinical, operational, and financial outcomes in healthcare by leveraging best-in-class technologies. So said a different way, it's how do we ensure a healthy planet through healthy people, healthy workforce, and healthy business. With healthy people, we focus on how do we deliver the highest level of care for the individual and for the population. Healthy workforce really focuses on the significant challenges that we have in our healthcare workforce across the globe, and healthy business acknowledges the shrinking margins in healthcare, not just on the provider side, but across the broader healthcare ecosystem, and how do we actually address that together?
So across those dimensions, bring it to life for us. Give us an example, quantify the impact, because you talked about healthy business, the shrinking margins. So how are you helping health institutions improve their margins? Where are you reducing costs? How are you improving health outcomes? Bring it to life.
Yeah, one of the clearest examples of that, Chitra, is the work that we're doing through our health data intelligence platform. This is really a platform that brings together the entire ecosystem of healthcare. And I want to double click on that for a second, because if you think about how do you deliver population health management, the way that we've been doing it up to this point really creates an 80% problem, which is 20% of what determines someone's health is the care that they receive within a delivery system. 80% of what determines someone's health is where they live, where they work, their habits, and that data is oftentimes lost and not included in population health management. We are the only hyperscaler who has built a platform that can bring in data from thousands of resources across the board, be able to aggregate, connect, and apply intelligence to that data so that we can help both the individual and the population in receiving precision medicine, exactly the kind of care that they need as we move forward. Doing that, we've been able to impact health outcomes when it comes to chronic disease management, like diabetes and hypertension. We've been able to reduce cost of care, everything from PMPM costs, per member per month cost, all the way to larger costs as it comes to readmissions or managing kind of value-based contracts.
Let's make it even more practical, because you've played leadership roles in multiple parts of this ecosystem. You're a doctor, you've been a chief operating officer of a large health system, now on the technology side. So you've been on both sides of the equation. How are you making it easier for doctors and nurses?
Yeah, that's a great question, Chitra, and one that we are, it's very personal to me as a physician and having been on the provider side for 15 years, but it's something that Oracle has actually taken on fully, and something that actually Larry is highly passionate about. And that's how do we help support this challenging equation that we have, where shortages in workforce across the board are visible, from physicians, nurses, case management, pharmacists, all the key areas. Cost of labor has gone up. On the other side of the equation, you have an aging population that consumes 2 to 5 times more healthcare than their similar cohort that is younger. So you've got less people to deliver the care, more people who are sick. So how do we bring all of that together? There's 2 major ways that we're working through that with the workforce. The first one is, how do we help augment the workforce? So we have clinical digital assistants with a number of other tools that really help augment the work of the provider by having really an ambient assistant that listens, tees up the provider's notes, that's physicians and nurses, helps do clinical decision support in that process, all the way to what are the things that we really can automate and move out of the workflow of care providers, so that, for example, if you're reaching out at a population scale to try to increase screening for colorectal cancer, getting a very personalized, empathetic, and automated message pushed out to patients that changes their behavior and increases your colorectal cancer screening rates.
All of that sounds great, and all of that sounds similar to what many other companies convey and express that they do as well. So whether it's the large cloud providers like Azure, AWS, Google Cloud, Epic, many startups at this conference. So who are you competing against, and how do you stand out?
Yeah, to be honest, Chitra, today we don't compete with anyone in this space because there's no other hyperscaler that's really bringing together the entire ecosystem of healthcare. We've got in the broader market groups that are working on the EHR side, and we have to make the electronic health record better. We are fully dedicated to that. But again, as we know, health and care across the globe is far more than the EHR, as we just talked about. Again, there's 80% out there that requires bringing in that broader ecosystem of healthcare, from payers to retail to food and beverage to life sciences. And Oracle is working closely with all of those stakeholders around how do we connect and apply intelligence to that data so that we can provide better health. Through the Cerner install that we have Oracle Health across the globe as the largest EHR provider across the globe, where we actually get real experience with how can we help impact communities, both within health delivery systems, but also as we look at where people live, work, and function outside of delivery systems.
Nasim, leadership. In life and business, there are rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
You know, being a code breaker, Chitra, for me means where have you consistently and persistently gone against where society was and where things were being done. And I think for me, if I was to look at a common thread across the board, it's my persistent and disciplined focus on how do we deliver person-centered care. So what does that mean? For me, when I was a practicing physician and in healthcare administration, at a time where healthcare delivery systems dictated to patients how care was delivered, I formed some of our earliest patient family advisory councils, where I brought patients and families together to comment on some of the common things that we gave them around patient education, like discharge summaries. And I actually brought them together with a red pen and said, cross out everything that you don't understand on this discharge summary, and got feedback that 75 to 90% of what we put out, this is back in the day of paper and pen, 75% of what we physically handed off to patients were things that they didn't understand. And we fundamentally changed our patient connection. We did patient-centered readmissions work. And that really has been a core value and core belief for me, all the way to today, where we have a lot of different technologies and capabilities. It's very easy to get excited by what's around the corner, but I've really kept my focus on how do we actually bring all of this together in service of the patient? How do we make sure that this data and intelligence that we can provide ultimately delivers precision care to that individual and improves the health and care of that individual over the entire span of their lifetime?
Nasim, thank you so much for joining us.
Thank you, Chitra.